This video is brought to you by Arizona State Schools for the Deaf and the Blind and the University of Arizona Sarver Heart Center. The Sarver Heart Center is dedicated to providing accessible information and continuing quality education for the community. Hello, my name is Jason Gervais and I am deaf. I am from Phoenix, Arizona, and I have been teaching ASL since 2015 at the University of Arizona and Pima Community College. Knowing chest compression only CPR is an important skill to have because cardiac arrest can happen to anyone, any place, and at any time. Before we teach you the 3 C's of chest compression only CPR, it's important to know the difference between a cardiac arrest and a heart attack. A cardiac arrest happens when your heart suddenly stops beating. If someone is having a heart attack, they are conscious, meaning that their heart is still beating and they can tell you how they feel. Things to look for is that they might be holding their chest, they may be pale or sweaty, and they may have radiating pain in different body parts. Some of these include the left jaw and arm, back, and neck. In the case of cardiac arrest, this person will unexpectedly collapse and they are unconscious. This is when you want to use CCO CPR. When cardiac arrest happens, use the 3 C's: check, call, and compress. First, check by shaking and shouting. If they do not respond, make a fist and use your knuckles to rub their sternum aggressively. Here we are causing a painful stimulus to see if they can respond to pain.
Are you okay? Can you hear me?
The next step is to contact 911. In this step, we want to initiate emergency response by asking someone to call 911. Text or calling depends on the state or city, so check if you can text or call 911. At this point, we also want to tell someone to go find an AED.
You, call 911. You, get me an AED.
Kneel next to the patient with your knees touching their arms. Take your first 2 fingers and place them underneath the patient's armpit. Trace to the center of the chest and place the heel of your palm where you traced. Interlock your fingers, lock your elbows so that they are straight and fall down with all of your body weight. Remember that you are not pushing with your shoulders but with your whole body. Compress and count 1 and 2 and 3 with a maximum of 100 chest compressions for one person. When in doubt, use chest compressions. However, chest compression only CPR should not be used on children under 8 and people who have had an obstruction to their airway. This includes choking, drowning, and drug overdoses. In these cases, use traditional CPR, which is 30 chest compressions to 2 breaths. If you are alone, first contact 911. Gasping is not normal breathing, and it isn't a sign that you have brought this person back to life. Gasping is inconsistent breathing, and the patient may be moving or violently gasping for air. Instead, this is a result of the brain receiving some blood and trying to restart the respiratory system. Do not stop chest compressions. Chest compressions are difficult, so switch off on chest compressions with someone every 100 chest compressions. Communicate with your partner as they count down from 5 or 3 when you are ready to switch. Do not stop chest compressions until emergency services arrive. That's it. There are only 3 C's and it can save a life. Just remember, check, call, and compress. You are protected by the Good Samaritan law in all 50 states. This means that you are not liable for the consequences that result from your assistance. Remember to always respect your patient, do the best you possibly can, and do not abandon your patient. Your safety is your priority, and if you ever feel that your safety is compromised, leave and call 911. If you would like more information on how to use an AED, please see our next video. Thank you for watching.